Okay, there we go. So, I'm a medical provider, and I figured it's time to start doing something with all these channels I have. I have channels on a variety of things, home repair and, well, you name it, all kinds of things. And the Understanding Your Body channel, I've been meaning to do something with for the longest time. And there's this like philosophy out there: do you get started quickly and then work on getting the quality of your videos up, or do you get the videos out there, or do you wait to get the videos out there until the quality can be really high? And so I decided it's January, it's a new year, I've been sick of waiting. I recently moved to a new job where I have a little more time on my hands, and I'm going to just start getting the videos out there and start working on the quality as I go. You know, the more I edit, the more I upload, the more I talk, the more I hear feedback. If I hear any feedback, the more I'll be able to improve on things. So I thought I would just start with something that would be pretty simple for me to do, which is talk about a case of the day. A patient I saw, can't give any personal details obviously, but a patient I saw. So I'm leaving work, and today I saw a patient, and she was in her mid-20s. She had given birth 16 days ago, a natural birth. That's a vaginal birth, not a C-section, without any complications. Mom and baby both went home the next day, and she was doing fine for 2 weeks, and then over the last couple of days she started to get a fever. And the next day, so yesterday, she started having body aches, fever, fatigue, just feeling really badly, and no cough, no respiratory symptoms, no runny nose, no ear pain, no sore throat, nothing that would make you think like upper respiratory, any kind of thing going on. No cough, as far as like nothing going on in the lungs, just a fever, and absolutely no other signs or whatever. One of the things you worry about in somebody who's in that postpartum, right after delivery phase, is do they have an infection of the uterus, which is more common with C-sections, but it can happen anytime you're pregnant. An infection comes in. What happens is basically it's difficult for the body to clean up an infection in the uterus, and you get a lot of discharge. It's usually got a foul odor to it, lots of vaginal discharge. That hearing that history or that on exam alone is enough, and you have to go to the hospital. You should go to the hospital, hopefully, if you just had a baby and all of a sudden you have pus-like discharge, and you need IV antibiotics. But she wasn't having any of that. All she had was a fever, no other symptoms. So maybe I thought she had some atypical flu. So I checked her for the flu, and the flu test was negative. And so I'm thinking, what could this be? And then I started thinking, well, this woman just went through the biggest change she's going to go through. In fact, when I studied what happens when a caterpillar turns to liquid and turns to the butterfly, I said, man, I found the pinnacle of what happens in biology out there. But as it turns out, when I studied human female reproductive, oh my gosh, just blows you away what happens to a woman's body over the course of growing the baby and delivering the baby. Just amazing. Chemicals, hormones that do one thing at one point in the pregnancy do a completely opposite thing the other point in the pregnancy. One of my favorite stories about having a baby and delivering a baby is what happens to these cells we call NK cells. They're actually called NK. The NK stands for natural killers. And if you think about these guys, they just roam around like vigilantes, and they look for anybody who's trying to cross the border into your body, and they kill them. I mean, they like rip them apart. They're natural killers. Well, what happens when a woman becomes pregnant? These natural killer cells, they migrate over to the uterus, and they start carving out pathways for new blood vessels, for blood supply for the baby. They just become in harmony with the woman's body. Instead of destroying life, they start helping create life. It's just fascinating to me. Anyway, so because a pregnant woman is going through so many incredible amount of changes, it's estimated that really 6 months until your body's back to the way it was before pregnancy. Maybe what we should think about is another source of infection. She could have had a walking pneumonia, but no night sweats. That's a big hallmark for pneumonia. No cough whatsoever. Her lungs sounded really clear. I listened to all the posterior fields with my stethoscope. I checked under her right armpit, looking for that middle lobe over on the right side. Nothing, not a thing. And so, I thought maybe this is possible. No breathlessness, no like decreased breath sounds, anything like that. So what's another source of infection? I said, well, have you been having any cloud of urine, any blood in your urine, any increased frequency, any pain with urine? She goes, no. I've had several UTIs, one every couple of years, and it always feels like I'm peeing razor blades. And I said, I wonder if maybe hormone changes, maybe some of the nerves getting compressed. This woman's only 16 days out from delivering a baby. What if she just can't sense that she has urinary tract infection? So we do the urinalysis, it's called. It doesn't necessarily look for infection, it looks for signs of infection. It looks for something mainly called leukocyte esterase. It's something your white blood cells make when they're actively fighting an infection. And it could be negative, there could be a small amount, there could be a moderate amount, or there could be a large amount. And she had a large amount with no signs. I'm not an obstetrician, but I think that she could have high leukocyte esterase just in a post-pregnancy state with her body going through so many changes. But we had no other source for a fever, and so we're going to presumably treat her for urinary tract infection. And while I'm talking about it, what is this video at? 6.5 minutes. So while I'm talking about it, let me just mention a couple other things about urinary tract infection. Well, one, my body, your body, everybody's body is covered in bacteria. Our palms, I think over 1 billion just in our palms. And they don't really like it out here on our skin. It's salty. There's nothing to eat. There's nothing to drink. It's oftentimes not warm enough. And they don't like it there. What they'd rather be is like in somewhere where they can get some food to eat, something to drink, something to keep them warm. And so they're always trying to climb in there. And this is a little bit of a hokey story, but I tell a lot of hokey stories. So this is a little bit of a cheesy kind of hokey story. It's kind of like the itsy bitsy spider. And so the itsy bitsy spider wants to climb up the water spout to get into the bladder. And so these bacteria are trying to climb up a woman's urethra to get into her bladder. They're trying to climb into men's urethra too, but the distance is too far. By the time they get any kind of headway at getting up the urethra, a man's going to urinate and pee him out. But the distance is so much shorter in a female that she can have bacteria make it from the outside world up the urethra into her bladder to start an infection. And so it's much more prone for women are much more prone to get it. And so it's like the itsy bitsy spider. They try and climb up the water spout, but as long as down comes the rain, it'll wash the spiders out. And that's why as a female you should never hold your bladder. If you have a long shift at work or back-to-back lectures at school or something like that, you just got to go use the bathroom when you got to go. You shouldn't sit there and hold it. You just got to go when you got to go. And so that'll keep urinary tract infections at bay. Oh, actually, also anytime that there's some kind of agitation in the area, something that would help the bacteria scoot up that urethra into the bladder. I'm talking about things like swimming, sex, horseback riding and bike riding. We have an area where I live where people go horseback riding often in the summer. I see people coming back from that all the time with, haven't had a urinary tract infection in years. Went horseback riding, I got a raging urinary tract infection. You really want to make sure you go pee right after that stuff. And then let's talk about, so the number one sign that you have a urinary tract infection is painful urination. It's often described as razor blades or burning, intense burning. It's like I'm peeing fire, people often say. But that's with your first urinary tract infection. When you're young, when you're in your teens, when you're in your 20s, and when you're 80 years old, you usually don't have what we call dysuria. You usually don't have painful urination. You know what the number one sign for a urinary tract infection in a geriatric, an older female is? Sudden confusion. Or sometimes we'd say sudden worsening of confusion if there's already some confusion there. I worked, for a short time, I worked in a retirement facility, like an assisted living facility. And at that location, there was a lady that would walk by, and every morning she would say, good morning, and she would, say my name, and she'd say, good morning to you, good morning. And one day I walked in there, and she said, good morning, now don't tell me, oh, what's your name? Oh, fiddlesticks, or whatever elderly people tend to say. And she couldn't remember my name, and I said, you know what, can we go ahead and check her for a urinary tract infection? Every day I walked in here, every single day, and she's always remembered my name, and all of a sudden today she can't. Sure enough, she had a urinary tract infection. So most people would say, I don't have a urinary tract infection, I don't have any pain. But that's not necessarily true. Certainly in elderly people, that's not your number one symptom. And it seems like, at least in this case, we're waiting on the culture on her urine. It'll be a couple days just to prove my theory. But at least in this case, it seems like this mid-20-something-year-old recently, in the postpartum phase, did not have any pain with her urination. So there's that. What do you do? Well, I'll tell you one more thing. Okay, we're getting a little long here, but one more quick thing. There was a study done, I think, in 2016. It might have even been early 2017, that showed urinalysis, the little dipstick test we do. When it's negative, it turns out it's more like only like 60-70% accurate, somewhere in there. And you know what was really accurate in that study? If you have a female who's had a urinary tract infection in the past, and she says to you, this feels like my previous urinary tract infections, that was somewhere like 97-98% accurate, somewhere up in there. I don't have the numbers off the top of my head, and you don't need to know the numbers to know if a female tells you that, it's positive. So in that case, with a female who tells you it feels like her previous urinary tract infections, or in this case where we had a urinalysis making me think that's likely the cause of this fever, we treated it. We'll treat her. We give her 6 pills, 1 in the morning, 1 at night, for 3 days, and that should treat it. She should be feeling better. I put a little note to give her a call. I want to make sure that's what it is. I'm going to give her a call tomorrow, make sure she's no worse, and we'll take it from there. All right, so this has been the first official case of the day, talking about unknown fever in a postpartum female. All right, take care.